Dr. Claytor here at the Cartessa booth at TetraPRO, and I'm here with Barry Stadler. We, being me specifically, love the TetraPRO. This thing is a workhorse in my office. It has so many different settings. My esthetician can use it with Cool Peel, right?
Cool Peel, yes.
How does Cool Peel do nationally?
Cool Peel has become our biggest brand. Patients love it for the little to no downtime.
It's true.
Almost painless. It's so easy to heal in just a couple of days and have really smooth skin.
This meeting is mostly for estheticians and nurse practitioners and PAs. So this device at that setting can be used by an esthetician.
Correct, yes. So the versatility of the Tetra is great. You can go for little to no downtime CO2 and then do what you do with it, which we all know is a little bit more than Cool Peel setting.
This machine can cut through wallboard. I don't use it at that setting, but it has that potential to act almost like a scalpel. And so where I use it is in combination. And I think that this is really the magic of this machine, is that it works and pairs so well with many of the other devices that people already have in their offices, such as a microneedling pen. And so what the microneedling pen does is it vibrates and punches holes down through the tissue. I like to say that CO2 laser reminds me of a very famous chef by the name of Bobby Flay, right? Bobby Flay says, okay, take your meat and you sear it on each side, and what does that do? Locks the moisture in, right? How does that relate to this? This laser, I feel that it seals the tissue, and it makes it very hard to get product in. Now, I know there are a lot of people out there who are using a product on a CO2 laser right afterwards, and I think that's great, but you really have a hard time penetrating deep. So when you microneedle right after you CO2 laser, it's like putting a key in the door, and then you open up the door down to the reticular dermis, and then the product that you add subsequent to that could get down to the reticular dermis, which is the workhorse of the skin. And so this device is so incredibly versatile because my esthetician can use it with microneedling and then an exosome or a PDGF. My PA, who's my injector, can use it at a higher setting, much higher setting, with microneedling and a PDGF or an exosome. Then you come with me into the operating room. I go, like you were saying, to really high settings to really improve those perioral rhytids. Microneedle 2.5 millimeters deep as you can possibly go. Then I add on Nanofat, and read the paper, it's out there. You can search it, Claytor LaMiNa ASJ. It heals this tissue so fast with zero pain, which is unbelievable. It's an amazing device, very strong, very powerful. Your customer service is fabulous. There was a day when I needed 2 of these. You guys came and dropped off another one. So to somebody out there, like a plastic surgeon, is this device have a home in their office?
Absolutely. I mean, you hit the nail on the head. There's so many people within a plastic surgery practice that have different tools on this same laser, whether it's an esthetician in certain states or an RN that's performing Cool Peel settings with or without microneedling, but then more advanced settings with some of the DecaPulse settings, which you mentioned. It's really just the most versatile resurfacing platform I've ever seen.
So what he's talking about with the Deca settings is you have different watts that you can set here. You can set the watt powerage, and what's nice about this, the new system, it goes up to 40 watts. The dwell time is the Deca, and so the higher the dwell time, the longer the pulse is actually acting on the tissue. So if we go down on the dwell time, the amount of energy is 31 millijoules, but if you go up, you see that the amount of energy goes up to 65. This is how dialable this is. If you really want to go down deep, you can do it, and you can do it highly predictably. I can turn it up, turn it down, and create incredible functionality with it. It's got so many different uses.
I think you bring up a good point too, really, in the versatility, specifically on the TetraPRO. This DecaPulse is the first time we've had independent control of how much heat we put in versus the watts and how deep we're going.
Yes.
So if you think about, with old school CO2, the only way to get deeper was to go higher watt, which was a larger thermal spread, right? So that's where increased downtime and bad experiences from old CO2
And so what you're saying is, it's a wider blast effect, except now with the Decapulse, it's a narrower beam that just goes deeper. Quite honestly, if you want to improve rhytids, you got to go deep.
You got to go deep.
You got to go deep. And then the other setting here is spacing. You can see that the density here, which is basically the confluence, when you're down at 0, it's 78% density, which means that 78% of the tissue has been thermally affected. But if you go up here to like 26%, so the spacing's 250, now that means only a quarter of the tissue has been impacted, which means that it's going to fill in very quickly. This is why it's called fractional versus ablative. The bad rap that CO2 got in the past was when it was ablative. You think of your snowblower clearing everything off, that's ablative. Think of those hole punches in your lawn that aerate your lawn, fractional. And that has been the game changer for this device.
Absolutely. I think also too, if you notice what happens when you go from this Decapulse to this high pulse mode, this dwell time disappears completely.
Yeah.
Because now you've taken this thermal tool that you're using to get skin tightening, to get all of those deep rhytids that you're talking about. We don't need that much heat in the epidermis when we're talking about treating pigment.
When you switch to the HP setting, you should really dial it down and go to a lower watt setting so that now you're only going down about 30 microns, and then you can even drop down and go to a higher confluence, so 46%, so you can be treating more tissue shallower. And again, that'll heal faster. And the beauty of this device is you can do both settings at the same time on the same patient. So you're getting a really deep tissue treatment and then a superficial treatment at the same time.
You're getting totally different benefits from those two different passes using the same laser.
And then if you treat with microneedling right after that, and then use a rescue of exosomes or PDGF or the gold standard Nanofat, boom, unbelievable results. Combination therapy.
That's where it's at.
That's where it's at.
Thank you, Dr. Claytor.
Thank you.
Thanks.